On the medical watch, Utah will become the first state to ban fluoride from public drinking water. A similar ban is in the works in Florida, too. Secretary of Health and Human Services Robert F. Kennedy Jr. has publicly pushed for a national ban on fluoride, but dentists and other health experts are pushing back against the idea, saying it is safe and successful in preventing cavities. And Dr. Mira Albert is a pediatric dentist in Hinsdale and a spokesperson for the American Academy of Pediatric Dentistry. She joins us now. Doctor, welcome. I guess it would be helpful to start off with a history of fluoride. Why and how did it get added to our public drinking water?
Yeah, hi, Ray. I'd be happy to address that. So I think the first thing that I want to talk about, though, is that dental decay is one of the world's most widespread public health diseases. And it's a complicated issue to solve because it's multifactorial and has to do with so many things: diet, brushing, biology, sugar, economics, other factors. One thing we know for sure is that fluoride definitely helps. Each year in the US, we lose about 32 million hours of school and work dealing with dental issues. I'd expect if we remove fluoride from the equation, that number will definitely increase, and we'll be doing many more restorative treatments like fillings, crowns, extractions. Where it all really began is, and what I really want people to know, is that fluoride is not a chemical additive, not at all. It's actually a naturally occurring mineral. It's found in many foods. It's found in soil and in water sources. I like to think of it similar to the way that we think about calcium strengthening bones. So fluoride really strengthens tooth enamel, and it makes teeth more resistant to decay.
And we know gum disease, I mean, that is just the start of it, right? That affects heart health and so much of what guides us. So why are communities, whole states, saying that, fluoride is a problem? It seems to go along with the vaccine skepticism, would you say?
Yeah, I think so. I think they're looking at studies that were based internationally in countries with much higher naturally occurring fluoride concentration in their water sources. Fluoride was actually discovered completely on accident in the early 1900s by a dentist in Colorado Springs. He noticed that his patients had this brown stained teeth, but very, very few cavities. Research traced that back to naturally occurring fluoride in the water sources in and around Colorado Springs. Scientists began studying the phenomenon. And the first fluoridated city was actually Grand Rapids, Michigan in 1945, so a really long time ago. It is actually one of the most widely studied public health topics in history, with about 65 years of sound evidence supporting its safety and efficacy. Our leading health organizations like the American Academy of Pediatric Dentistry, absolutely support it as safe and effective and a simple, well-studied, natural way to safely strengthen enamel and prevent cavities. So that's sort of kind of the brief history on it and why people are looking at it. But these studies are really correlative studies. They're not causative. So they fail to account for other factors that could be at play, like malnutrition, pollution, genetics. And it gets dicey when you start looking at studies and relying on correlations. Also, the water levels, the fluoride in our water levels are very highly regulated in the United States, meaning that the U.S. Public Health Service recommends water fluoridation at a level of 0.7 parts per million. To easily understand that quantity, it would be about 42 seconds in 1 million minutes. So it's an extremely small level of fluoride that strengthens the teeth without staining them. So the way that the teeth were stained back in Colorado when it was initially discovered.
Right. Well, I appreciate that you are bringing the science forward to try to fight against this and keep us updated on your efforts. We appreciate you being with us this afternoon.
Sure. Thank you.
Thank you.